We will never know how many friends and family didn't get COVID-19 because we followed safeguards. We'll never know that number. We'll never know how many lives we saved because we wear masks, wash our hands, and keep our distance. We'll never know exactly who we help when we take protective steps each day. We'll only know that we did all we could to save people from a dangerous pandemic. And that's a nice thing for us to live with. Together, we are beating COVID-19.
Good afternoon. On behalf of the Hispanic media and our title sponsor, Blue Cross, we are happy to have you one more time here to be able to educate our Latinas on health and wellness. Today, we have two fantastic panelists. We have Mercy Mosquera, interpreter and manager of Tierra Colombiana, also advocate of health and wellness. We also have the Dr. Jabal Uffelman from Miami, and he's a board certified gynecologist with an additional certification in anti-aging and orthotic medicine. So we just want to talk a little bit about health and wellness and what's important, especially right now with everything that's going on. And for me, I believe that the health and wellness right now is the priority with the pandemic, and I think everybody's taking care of themselves. Why don't we take time so you guys can introduce yourselves? We'll start with Mercy.
My name is Mercy Mosquera, and we own a couple businesses in Philadelphia for more than 20 years. And I've been here in Philadelphia for almost 30 years. I'm Ecuadorian and part of the community.
Absolutely. We appreciate everything you do. Doctor, if you have never been to Tierra in Philadelphia, it's amazing. The food is fantastic.
Never. Oh, I can't wait to go.
So when you go down, remember, see Marcy at Tierra Colombiana.
Look for Marcy? Okay.
Yes.
Trust me, she'll take care of you. Doctor, can you tell us a little bit about yourself?
Sure. And we're going to speak in English, right? I can speak Spanish too, but the audience is...
We're bilingual here.
Okay, good. Well, I'm a board certified gynecologist here in South Florida for 20 years now. I did my residency at Jackson Memorial in the University of Florida, or University of Miami, sorry. I did my medical school at University of Florida in Gainesville. So I've been here in private practice for a good 15 years now. I changed my practice about 10 years ago, and I went away from the baby deliveries and all that drama to aesthetic medicine and anti-aging. So I still do the gynecology. In fact, I have surgeries today in gynecology. But I also do a lot of facial aesthetics like Botox and taking care of the skin and anti-aging with the Rejuv Chip, which is, I'm not sure if you're aware of what that is, but that is a subcutaneous natural hormone therapy that is great for men and women for controlling the aging process, and also giving a lot of energy and sex drive and muscle mass and decreased body fat, a lot of things that we need these days more than ever. And also I do a lot of vitamin therapies to help boost people's immune systems and make the skin and hair nicer and make the hormones work better. So pretty much everything we offer here in South Florida in 3 different clinics for age management and
fantastic. Doctor, a question for you. You guys have a couple different locations. I believe you have one here in New Jersey.
Yeah. Yes, we have one in Fort Lee, New Jersey, which is right across the bridge from Manhattan, Fort Lee. And we also have 3 in South Florida. We have Doral and Brickell, which are in Miami, and one in Fort Lauderdale. So 3 locations in South Florida where I go to all locations, and I also have some practitioners that help out when I'm not able to be there. And in Fort Lee, we have our practitioners that are also doing the chip and the IV vitamins and the aesthetic medicine. And I go up there occasionally, but not so much because I'm so busy down here, and they have their own practitioner up there.
Understood. Doctor,
check it out. It's a nice office.
Is it?
Yeah.
We'll have to stop and see. Well, doctor, what's the signs and symptoms of aging?
Oh, the signs and symptoms. Well, most people see it in their skin and their face. The face, as we get older, the cheeks start dropping. The cheeks slowly start dropping, causing these wrinkles here and here, in the under eyes too. And the quality of the skin gets dry. Also, we have less energy. Exactly. It starts early too, so it starts in your 30s. And less energy and less sex drive and less results in the gym. So it's physical things you can see, and it's also things you can feel. More aches and pains. I think we're all aware of this. unless you're in your 20s, in which case you're still doing okay.
Understood.
I have a question, doctor. Well,
yes, Mercy?
I think I'm one of, I can be one of your patients soon.
Okay. Oh, that would be my pleasure. Thank you.
You can see I need a lot of retouch. So I'm going to be.
Okay. Are you up in Philadelphia?
Yes, doctor.
Okay. You got to make the time to come down to Miami and I'll check you out.
Yeah. I always go with Ricardo and perfect.
Okay.
I can't wait to go and, do something for my age. I'm going to be 50 soon. So.
Oh, I know. Yeah. I know
Yes.
how it feels. Me too. I'm in the same boat.
Okay. So we understand each other, how we feel.
Yeah.
And
Totally.
how we can stop that, get older and showing our, especially face the aging, how, you what
it's a great question. What can we do? Exactly. It's a great question. First of all, it's not any one thing. It's a combination of many things. Eating healthy and doing exercise is great for your positivity, your skin. It shows in your face if you're managing stress by living a healthy lifestyle. So we all know about eating better and doing exercise, many supplements we should all take. We don't want to go into it now because there's so many things. But aside from all that, the chip, which is its primary focus is to slow the aging process. And it's done by placing this little tiny piece of rice into the body, under the skin, into the subcutaneous fat of the hip area. And that little chip releases a natural hormone into your body slowly. It's the hormone specifically called testosterone, which is men and women both need it. It's the hormone that activates your metabolism. It activates your energy. It gives you muscle mass. It also makes your skin softer and less wrinkly because it makes the skin a little bit oily, almost like back when you were younger and you had acne. That's actually one of the possible side effects, but it's not common. But making your skin a little more oily is going to make it softer and less wrinkly. So just by putting that chip every 4 months in women and it's 6 months in men, you pretty much do the most work of anti-aging that you can possibly do. The rest is just living healthy and not smoking, not drinking in excess, etc. Managing stress, taking lots of vitamins. I mean, it's really not magical, but the idea is we need hormone replacement as we get older in order to keep our tissues healthy, in order to keep our joints from being inflamed and painful. As we get older, we get a lot of aches and pains and we can't remember things. So our whole body is sort of feeling the effects of the aging process. I think everyone can relate to this. So the chip is the foundation for keeping your body younger. And then of course, it's a matter of taking all the important supplements that you need and eating healthy, eating salads, eating fruits and vegetables, avoiding red meat, avoiding carbs always. And I think, we always know, we know all this stuff now because we have so much information at our fingertips now. But what a lot of people don't know is that hormone replacement done safely and with the chip is a great way to manage the aging process. You kind of have to do it or know somebody that did it to hear how it works and the effects. But you can see in somebody that's done it, you can see they just look more, their skin looks pinker, less wrinkly, and they usually appear more calm and they don't complain so much about, the aging process. So.
Okay, so you are telling us that, your recommendations as a doctor, it's first of all, eat healthy. I do believe also sleep enough. It helps a lot.
Absolutely.
And the habits that we should have is work out, which I do. I do work out every day, 5-6 days a week.
Wonderful.
And and on top of that, the chip, right?
Because yes, even though you're working out more and more and you're eating healthy, your body stops producing this hormone. Your gonads or your glands, in your case, it's the ovaries, and then it's the testicles. These little glands, they slow their production. The glands in the body age just like the rest of our body. So
in what age? I'm sorry. In what age do we stop? And in what age do you recommend us to start using the pellets?
It really is a gradual phenomenon. It is a sort of a downward decline in levels that starts when you're 20, and when you're 40, it's about half what it was. it just keeps going down. So it's not really that you reach a certain age and then you need to worry about it. It's sort of a gradual process. I would say as far as the chip goes, it starts working. Women about 35, need it, and they start getting benefits from it. If you're younger in your early 30s, you don't really need it. So you can do it if you have specific indications or reasons, but it's not like it's really helping something because you don't have the hormone loss yet. But women after 35, so in your case, you're already a great candidate. And men after about 40, we start feeling the hormone loss. And again, I'm specifically talking about testosterone. So we're not talking about getting a woman estrogen, which is the hormone that is linked to breast cancer. Testosterone is a protective hormone against estrogen, actually. And it's something that a lot of people are low in today more than ever. And if I may, I'll explain why. There's a lot of chemicals that we're exposed to, I would say, like pesticides, plastics. These chemicals, as well as hormones that they give the animals that we consume, are all making us higher in estrogen and lower in testosterone. So this is something that's very well documented scientifically, and it's something we all have to worry about because it's meaning a lot of people are having problems losing weight. A lot of women are getting breast cancer and thyroid problems. Right. And a lot of young girls are entering in the puberty at a very young age. And it's because of this world we live in, which is full of harmful chemicals that behave like hormones in the body, specifically estrogens. So we're kind of like surrounded by estrogen. It's making the whole world a little more feminine in a bad way. Okay. And like I said, breast cancer, difficulty losing weight, prostate cancer. These are all things we can attribute to hormone imbalance. In women, fibroids, heavy periods, very common problems, fluid retention. A lot of women these days have these hormonal issues that their issue is not, it's excess of estrogen and too little testosterone. Men and women are having these problems. So the chip is the best way to replace the testosterone in a way that it feels like you're making it yourself. It's actually coming from inside your body and it's releasing very slowly, like it's coming from your own glands, your testicles, your ovaries. So it's something more and more people are needing and inquiring about. So that's why I'm staying busy.
Okay, good. Thank you.
Dr. Jabal, you created the Rejuv Chip. What was your reason for creating it? And when it is put into the human being, how long does it last and why does it last that time frame?
Well, let me correct you that this product, which is a natural hormonal product called pellets, hormone pellets,
okay,
is a compression of a powder. That's the raw material. It's a pure hormone powder. They compress it into these little cylinders and they sterilize it. And then you inject it into the body and it dissolves slowly. That was actually created in the 1940s. So we're talking about 80 years ago. This is something that's not new. What I did was I created a technique for placing the pellets in the body, okay? And a program for not only doing the pellets, but also taking supplements and the whole program of basically age management based around pellets. So Rejuv Chip is my brand. It's the name of my clinics. But this therapy is something that's been around for many, many years, and it's got a lot of data, a lot of scientific data that shows that it's safe and effective. But the reason I got into it and I started doing it about 10 years ago is because I wanted to be able to offer my patients in the menopause that have hot flashes a better alternative than traditional synthetic hormones, which are linked to cancer. And they do resolve the hot flashes and the brain fog that menopausal women get, but they don't give energy and sex drive and vitality. So when I learned about testosterone pellets, I just thought it made perfect sense. It was something that nobody was really talking about at that time. So I developed the whole Rejuv Chip program and the marketing and everything. But I can't take credit for the actual therapy. It's something that was invented in 1938.
Wow.
Yeah.
Interesting. Well, it's good that you reinvented it.
Yeah, that's it. I'm championing it.
Hey, that's always good. We need that. Doctor, why does the testosterone, in particular male sex hormones, play an important role in both men and women?
Well, a hormone is basically a molecule that floats around in your blood produced by glands, produced by endocrine organs, like your thyroid, your ovaries, your adrenals. These are all glands that produce hormones. And the hormones, they go around in the bloodstream and they find cells that have receptors for the hormone. So this is basically, it's like a key entering a lock.
Okay.
And then that sends a signal into the cell to produce a protein in the nucleus to activate DNA synthesis, protein synthesis. And what this does is it's activating the cells to do a certain function. And it's a very complex conversation to have. But basically hormones, they circulate in your blood and they cause your tissues to become vitalized and to function properly. And every hormone has its own different, mechanism and benefit and use. But if you look at all the cells and all the tissues in the body, you can find receptors that fit the testosterone hormone. So the hormone comes along, it locks into the receptor and it does its job. And we can study the human body from head to toe, and we can see that there are little receptors, microscopic on the cell surface, that do the work of testosterone all over the body. So we're talking about your skin, we're talking about your brain, your bones, your sex organs. The whole body has receptors and therefore receives signals from testosterone to function properly. Specifically in the brain, the testosterone activates blood flow, so you get better thinking and concentration. It also activates a part of the brain called the amygdala, which is like the primitive brain that we all have. It's the same part of the brain that even lizards have. They call it the lizard brain sometimes. So the amygdala is where our primitive drive exists, and testosterone activates that center to have sex drive. Okay, so this is like women that don't have libido, and they need more sex drive for their relationship, for their own quality of life. The testosterone is like magical the way it works. It really wakes up the sex drive. It also wakes up vaginal lubrication, testicular. For men, it helps with erectile dysfunction. The erectile dysfunction. So it has that the testosterone affects the whole body, brain, all the organs, muscles. It makes your muscles grow. It is the hormone of vitality. So it affects men and women really in the same way. The dosing is dramatically different. A man uses a much higher dose, but we both need this hormone for maintaining our activity levels, our energy levels, our sex drive. And as we get older, the reason we're lacking these things is because we don't produce enough of the testosterone ourselves, because our glands are aging, and that's just a natural part of aging.
Right.
But this is something that with the chip you can overcome. But it affects the whole body in both sexes.
Interesting. Thank you.
Yeah.
Very interesting.
Yeah.
Do you have any question, Jane?
I think I know that we are running a little short of time. With the doctor, do you have a little bit more time? I do have a few more minutes. I want to talk about the procedure. Perfect.
So just because sometimes people see the video and they think, wow, that must hurt. Because the little chip, it goes into the body fat of the hip or of the butt cheek, sort of in the hip area, or in the flank, which is a little higher up. Wherever there's fat in the patient, we do a numbing shot, lidocaine, it burns a little bit, but it's not painful. And then you just do a tiny little incision. I'm talking 2 or 3 millimeters. And this little instrument passes the chip under the skin into the fat, but it's not painful. All you feel is the initial sting of the anesthesia. And then the chips are put under the skin, and you put a Band-Aid over that, nothing but a steri-strip, so we don't even need to put a suture. And then we tell the patient don't work out for 3 days. In the case of men, and women, it's only 1 day. And the chips, the procedure itself, just to let you know, it's very well tolerated. It does not hurt. It's not complicated. There's no issues, very rarely any issues. Of course, the patient comes in for the consultation, and we discuss all this in person. We do a physical exam. We do lab work. But once we finally make the decision to do the chip procedure, it takes like 2 minutes, and you walk right out of the office, and you can drive, and you can really do anything except for workouts that same day. And it doesn't usually hurt later on. It's just a very easy procedure. That's what patients want. They want things that are not invasive and that are not complicated. And there's really like no downtime.
I have a question, doctor. So you was talking that also we need to help with vitamins or some of these testosterone, like, but pill, how faster the chip works and how better works. And if it's longer, it takes longer the process to see the effects, or what's the benefits from?
Well, typically,
Go ahead.
good question. After the procedure is done, the chip is just healing for a few days. It's not doing its job yet. You just put it under the skin to the fat, and it takes about a week or two to start feeling the effects, the energy, the sex drive, the vitality. So it's a very gradual process where the chip releases into the bloodstream. And it really takes about 2 weeks before you start really feeling anything. And in women with menopause, they'll say their hot flashes go away, they sleep better, they have more energy. I think the energy is really the most essential thing for most of us. We need more energy. So you place the chip, it heals for a few days. About 2 weeks, you start feeling it. And the effects last in women, about 4 months, as long as that chip is still releasing and dissolving. And then about 3 to 4 months, it's a gradual process. It starts just disappearing. The levels go down. And in women that have menopause, they'll notice their hot flashes coming back. So every time you put it, it's got sort of a lifespan, the chip does. It's got a curve of action. And the patient can feel that as it's starting slowly and then as it's finishing slowly. So, and the benefits, like I said, is just you feel a lot of relief from feeling old, from the aging process in general.
Or energy.
Have you ever heard of fibromyalgia?
Yes.
Fibromyalgia? It really helps with that a lot. A lot of women suffer from fibromyalgia and they have pain like in all their muscles, like little trigger points, and they have problems with sleep and they feel inflamed. And the chip is like a miracle for that because it works like no other drug that's natural. But this hormone chip is what's called a bioidentical hormone. It's a natural hormone that's derived from a plant. And it's the same molecule that our bodies produce. So this is not like some synthetic drug. It's derived from nature. It enters into your system, and it's exactly like the same hormones our bodies make and our bodies respond to. So there's really nothing like it. It's not a synthetic invention. It's the actual hormone that we already need. And it exists in nature.
That's very good. I mean, I think this is perfect, and the way that we need to stop our aging is very good. And talking about, and I know that this is great for women and men, but not everybody can afford. Like the price depends. It's one price for everybody. It's the same price for the chip.
All women, it's the same price, and all men, it's the same price, even though each men and women, they do different doses, but it's always the same price for females. Yeah, the price can vary depending on the city. In Miami, it's for females, it's $450. And men,
it's not bad.
It's not bad.
That's not bad.
900. It's not bad. It's totally, yeah. Men, it's more. Men, it's 900 because a man puts many more chips at the time. So
I think it's perfect because if we are talking, to extend our life and be in a good shape and have more energy, especially because of the 45s, we start going down a little bit.
Totally.
It's perfect. You are talking about a small investment of probably $1,200, $1,300 in your body, and like sometimes we just waste money putting on others.
Totally.
We don't need it, but this is about our health. Yep.
Yeah. Yes. Try to think of it this way, Marcy and Eugene. Think of it this way. You've been to let's say an old folks home or a nursing home, right? You've been to a nursing home before?
Yeah.
¿Cómo se llama? Una hospital de ancianos.
Mm-hmm.
And you look around and you see everybody is like 80 and 90 years old, but they're all very fragile and they're sitting in a chair and they're not moving and they're not talking and they're just kind of sitting there wasting away. We don't want to be like that when we're in our final years. We want to be active and our brains working and enjoying life, not suffering for the last 10 years of your life. That sounds horrible.
Exactly.
Is there a certain cutoff age that you couldn't use it? Curious, because I know there's a lot of women that are active in their 70s, but could they also take it, or is there like?
Absolutely. No, the older you are, the more beneficial it is, the more miraculous the effects are. So the older you are, the better. We tend to use lower doses at older ages. However, it's still a hormone that keeps your your bones and your muscles and your skin strong and alive. If you look at a person that's 90 years old and they have not been using hormones, their skin is just falling off and they bruise easily and everything's very fragile, including their bones, including their brain. So this is because they've spent many years without hormone support. And if you look at a lot of these women that are like celebrities in their 70s and 80s, they look amazing. And it's not just because they've had facelifts and they do Botox. They're on hormones. They're on natural hormones. Suzanne Summers, Jane Fonda are people that talk about it a lot and they write books about it. But this is something that everybody needs so that we don't become old and fragile or frail.
Yeah. Doctor, you create this chip. You create this fight. How do you feel? Can you tell about, I mean, you explain us that, you did it because of your patience, but also what else it makes you, create this?
Well, for me, it's been amazing because my first patient was my mother and she needs it really bad. So I get to see her every 4 months and I get to put her chip, keeping her healthy and keeping her brain functioning. I myself am a patient. It's made my life better because I feel stronger and everything works better, so to speak. So I feel amazing. And really the best thing is just all these patients that I've taken care of, they almost all of them, I would say over 90% are very happy and they're very thankful and their life is much better for this treatment. Now, like I said before, I didn't create this. It's something that existed since the 1940s, but I have championed it and popularized it. I've traveled the world doing courses and trainings for doctors to share the technology, because it's just an amazing thing. And it's something that people need, even during the pandemic, when everything was closed, patients were still trying to come in for their chip because when it wears off and you're in a stressful situation like the pandemic, you need it. You need that reinforcement. So that's when I really understood that it was an important.
So you say therapy. That it helps with the depression, like it makes you feel better.
Absolutely. It gives you mental energy and
that's perfect. I'm next.
Focus and self-esteem.
I am next.
Doctor, first of all, Dr.
Eugene sounds a little too young, I think. Eugene.
Me, I'm 30. Are you 30? No, I'm 40.
Too young, Eugene. You're too young. You can't do it yet. I'm sorry.
Listen, you're right, but listen, I want to make sure that I'm okay. I'm 40.
I'm going to ID you. I'm going to check your ID.
Yeah, you can ID December 28, 1979.
You can do it if you're 40.
Listen, I want to thank you, Doctor. It was a pleasure.
Thank you. I want to
thank you for being a panelist.
I appreciate your time.
Thank you very much. We appreciate you.
Absolutely.
Hopefully, we get a lot of clients.
Thanks, Marcy.
Thank you. Nice to meet you.
Marcy, thank you for coming out.
Thank you.
Okay, you guys are awesome.
Summit, 2020.
Thank you so much.
Thank you very much. Okay. We hope to see you again.
Hazlo por los pequeños y por tus mayores, para que cuando todo pase, no falte nadie.
Por lo que más quieras, lávate las manos.
Pensilvania se une contra el COVID.
Pagado con los fondos de los contribuyentes de Pensilvania.
Hazlo para que los negocios sigan abiertos y puedas mantener tu trabajo.
Por lo que más quieras, mantén la distancia social.
Pensilvania se une contra el COVID.
Pagado con los fondos de los contribuyentes de Pensilvania.